Hi, I'm Lusi, Sheehan, the Wound Educator, and my vision is to improve wound care literacy and minimise harm caused by wounds in the community. And I would love to share wound education with our Woundieverse and be part of this community where we can improve our expertise, skills, and I'll always learn through evidence as well as other wound care clinicians in the field. I practice wound care in a community pharmacy setting in a couple of pharmacy-based wound clinics in WA, and also through the Wound Educator entity where I provide wound care education to allied health and help other pharmacists establish wound and compression clinics. I've been providing wound care for about the last 6-7 years since I did the Monash Wound Graduate Certificate in Wound Care back in 2016. I get a lot of referrals from allied health professionals for compression therapy, compression stockings or bandages. So naturally I have a bit of more experience or exposure to people with lower leg issues like chronic venous disease and leg ulcers, and I find that really interesting and fascinating because it really makes a huge difference to see patients' wounds improve and lower leg symptoms improve over time through applying the right compression stockings, the ones that fit them, that I feel comfortable for them, and also being able to actually get them to adhere to it long term. I would say that we need to look at wound care as a specialty and someone with a wound as a condition rather than just something that you put on some antiseptic or a band-aid or some antibiotics and off you go and expect them to heal overnight or over a week. It's much like diabetes or cardiovascular disease. We need to focus on the whole patient and assess the wound, consider the factors like, what conditions and medications do they have that could impact on the wound healing rate, their social factors, their age, their skin integrity, and all of those things like nutrition and mental health, and utilize our team of specialists and allied health to help us provide a collaborative team effort to help improve a wound. And often it can take weeks to months before you see a wound heal. So it's something that requires ongoing care, assessment, review, treatment plan, and that dedication to healing. So if this is an area that interests you, then I would highly recommend you to try and upskill and go to education sessions or these wound care education events to really improve our understanding of how a wound works rather than just sort of putting on something and expecting it to heal. Well, one of my most interesting wound stories is one of my patients who were referred from a plastic surgeon for lower leg edema and some maintenance wound care while she's booked in to have a skin cancer procedure done in her lower leg in about a couple of months. So we'll see her, assess it, provide compression stockings and also some maintenance wound care to help make sure we prevent from infections, keeping it clean and keeping the areas nice and moist and those basic concepts. So we saw her a couple of times a week, and she started wearing her compression stockings, and we noticed a significant improvement in her lower leg edema, which the surgeon's also very happy about, which is because it helps to reduce complications from surgeries. But what we didn't expect was, after a couple of months, I received a lovely card in the post saying that the patient said that her wound had actually healed, and her plastic surgeon said that she no longer required the skin cancer procedure. So that one came as a bit of a shock and something we didn't intend to do, but it was a lovely surprise. Well, it's interesting that you bring that up, because just recently we've had the 60-day dispensing policy come into the community pharmacy, which means that that pharmacies, a lot of them are struggling financially because of the cut in the PBS funding. It's estimated to be about 170 to about 200,000 per year per pharmacy, which is very distressful and can be very an anxious time for a lot of pharmacy owners and pharmacists. So if I had the opportunity to talk to a politician, and also the Honorary Mark Butler, who did make a promise to us that every dollar that's being cut from the pharmacy will be reinvested back into pharmacy, I would strongly urge him to action that and deliver that promise right now. And I would say that wound care is one of the avenues that pharmacists can make a significant difference in. Currently, the aged care budget and the government is spending about 6.6 billion on chronic wound patients every year, and patients are out of pocket about 4,000 for their wound. So this is really significant, and pharmacists can provide better acute care and also reduce the delay in wound care and prevent hospitalizations from chronic wound care through triaging and collaboration. And I would make it very clear to them that we really need the funding to support us to better do this, through funding services, our time and consumables for wound care, to reduce this cost to patients as well as the government hospital burden. Well, it's hard to pick the worst one, but I can think of a couple of common ones. So one is, commonly I get a prescription for mupirocin ointment for an open wound that may have a bit of local infection, and the patient's been told to apply on it 3 times a day and then just leave it open, let it dry out. And unfortunately, we know that mupirocin as a topical antibiotic is not indicated for open wounds and is not part of the wound infection guidelines. So it's something that often I have to tackle through education, the patient, but also the prescriber at the same time, and then provide a wound care service that is going to help the patient outcome through the basic wound care healing concepts. Another common one I get is just putting steri strips or adhesive closure strips over an open gaping wound that has been left open for several days and may often look a little bit sloughy. So closing it through primary closure is not appropriate. So we need to educate ourselves in terms of what is evidence-based and how do you heal an open wound through secondary healing. So I would advise everyone to join the Woundieverse that Gary has created to always learn through the evidence guidelines as well as from other wound care clinicians.